Hello, my name is Kimberly Davis, and I've been asked to speak to you a little bit about what I do and how it relates to anatomy and physiology. My background is in Oriental medicine. I am a master of traditional Oriental medicine, and basically what that means to you is that I do acupuncture and that I treat diseases and pathologies of the body using herbal medicine. So in order to do this, it's really important that I know about anatomy and physiology. First of all, I'm going to be using needles and putting them in the body of my patients. So it's important that I know where different organs are. For example, if I'm putting some needles in the abdomen, I need to know what's under the skin. So I had to study a lot of anatomy so I didn't make any errors. For example, if I were putting needles in too deep, I could puncture the stomach or the intestine. One of the biggest problems we have and that we're most concerned about is the lungs. And it's possible when you're putting needles on the front of the body to puncture a lung. So it's really important that I know where the lungs are, under which points they are. Some other things that are interesting about Chinese medicine is that we use it a lot to improve digestion. If someone has problems with digestion, we can use needles to get things moving. Perhaps if they're having trouble going to the bathroom, we could use needles to move the digestive system and increase peristalsis. I could also choose to use herbs to do that. And just like I have to know where the organs are for acupuncture, I also have to know the organs of the body and which herbs go to the organs. For example, if I'm trying to make someone go to the bathroom, I'm going to need some kind of herb that when it's digested goes through the stomach to the large intestine. If I'm working on someone with heart disease, I need to know that this is an herb that has properties that will travel to the heart. One thing we could talk about is diabetes, for example. Chinese medicine practitioners treat a lot of cases that involve internal medicine. A lot of people think of Chinese medicine really for pain and injuries, but internal medicine is certainly something that we do a lot of work in. As I mentioned, diabetes could be an example. Let's talk a little bit about a case study. We'll talk about a patient that has diabetes. Let's say we have a patient come to the office who has type 2 diabetes. Usually they'll bring along their lab work, so you know a little bit about their blood sugar and how it's been fluctuating. We would treat diabetes a little bit differently than your typical Western doctor. Most people will be on perhaps some kind of medication from their doctor, like metformin, for example, which controls blood glucose. We know that diabetes can manifest differently in different people. So in Chinese medicine, we're going to do a really complete history of the person. We're going to find out how their sleep is, how their digestion is, how their bowel movements are, how their strength is, if they're sleeping. And we'll take all these things into consideration as well. What we'll do is ask them a whole lot of questions about their life and what's going on with them, and then we'll form a pattern. So, unlike in Western medicine where they might say, your diagnosis is diabetes, we'll take that diabetic and we'll give them not only that diagnosis of diabetes, but also a Chinese diagnosis, which is just a little different theory of medicine and uses a little different terminology. So we would actually feel their pulses because we use the pulses to find out what's going on in organs. In Chinese medicine, when we feel the pulses on the wrist, we call one of the pulses the spleen pulse, and the Chinese have called it that for like 2,000 years. Really, it's probably closer to what's going on in your pancreas. And if we have some signs of something wrong in the pancreas, this might be what we would see with the diabetic. So in that case, we would look at that and determine if we want to make things move faster. We would give them a diagnosis looking at a number of factors. We want to know if they're running too hot or too cold. We want to know if they have too much of something or too little of something. So we'll ask them things about how their sleep is. If they're not sleeping, something's very often making them too hot. So we'll try and find some herbs that will cool them down. Lots of diabetics have some dryness in their bodies. They don't have perhaps the blood flow and the digestion and the use of glucose and glucogen like we'd like them to have. So we'll find specific points that help to activate the pancreas, get it going, get it working better. We'll also use some herbs to do that. We'll target the pancreas, and we'll also target side effects of diabetes, such as thirst. So we might give them, choose points or herbs that help to diminish thirst and increase fluids in the body, get the body to better use fluids. When we treat diabetes, we're likely to also look at the function of the kidney and see does the person have edema, for example. If they have edema, we would choose specific points on the body that treat edema. Some of them are on the ankles, some are on the knees. So once again, it's important to know the Western medicine that you guys are learning, diabetes and how that works, and then to be able to take that and also look at another theory of medicine, bring the two together so we can work hand in hand with people's doctors to help with the symptoms as well as the causes of diabetes. So we'll do symptoms, which we call branch treatment, and we'll also do causes, which we call root treatments. So we'll try and figure out, why does the person have diabetes? Not just treat the symptoms of it, but also try and figure out what organ's not working quite right, that this person is not able to process glucose properly. Lots of times, honestly, it relates to the diet and what people are eating. We have lots of exposure to a lot of foods that really weren't around years ago, and we're eating lots of things that probably we weren't designed to eat. We're designed to eat fruits and vegetables and maybe a little bit of protein, and not a lot of stuff that we tend to eat, high-fat stuff, trans-fat stuff from fast food restaurants, processed food, and that all kind of feeds into diabetes as well. So hopefully this has given you a little bit of idea how broad Chinese medicine is. It's a huge subject. It took me almost 5 years to learn about it. I had to learn an awful lot of the things that you guys are learning, and what you're learning is like a really great place to start out, to learn the basics. If you have interest in any kind of medicine, you've got to start with some really solid anatomy and physiology and then branch off in the direction that you want to go.